Hello Iron Brigade, I am Sergeant Shockley and this is Specialist 9. We are members of Charlie Company Chaos, 1st Battalion, 68th Armored Regiment, Silver Lions. Today we will be giving a block of instruction on the EIB Task M7, apply an occlusive dressing and perform a needle chest decompression. Task: treat a chest wound and tension pneumothorax. Condition: you are a member of a team on a combat patrol that has come under small arms fire in a non-CBRN environment. You witness a teammate in the open receive a gunshot wound to upper body. Your teammate was able to move to you and is responsive. You are behind cover, not under hostile fire, and your teammates have established a security perimeter. You must begin treatment while waiting on medical personnel to arrive. The injured soldier is alert and complaining of difficulty breathing. Another soldier is helping you finish the casualty assessment and is obtaining the other vital signs. Standard: perform all tasks as standard, in sequence, within 10 minutes, without causing further injury. Station requirements: a simulated casualty, mannequin with all extremities and ribs that can be seen and or felt, and a full combat uniform per unit SOP, including weapon and fully packed and provided first aid kit, IFAK. Casualty must have 2 simulated gunshot wounds to the upper body, 1 in the front, entry, and 1 in the back, exit. A TC3 card with administrative data already filled out, alcohol, pens, and eraser. A basic life support BLS bag with occlusive dressings and or materials with which to improvise. Pulse oximetry device, fingertip, and alcohol swabs. May cover the screen with tape and degraded vitals for testing. Provide the candidate with or ensure the candidate has watch with the correct date and time. Performance measure 1. Apply an occlusive dressing. Expose the injuries. Apply an occlusive dressing to the entry wound. Upon full expiration, cover the wound with a large occlusive material dressing, covering the first wound encountered. Ensure the material extends 2 inches beyond the edge of the wound. Tape all 4 sides of the dressing if non-adhesive dressing. Log roll the casualty on unaffected side and examine the back for an exit wound. Apply an occlusive dressing to the exit wound using the same standards as Step B. Performance measure 2. Verify the presence of a tension pneumothorax by checking for at least 3 of the indications below. Verbalize as needed. Question the casualty on difficulty in breathing, pain on the affected side, or coughing up blood, and observe for signs of progressive respiratory distress. Grader will state, casualty is gasping for air and has pain on the wound side. Observe the casualty's bare chest for respiratory rate and abdomen for progressive distension. Grader will state, casualty has poor respiratory rate and depth, and the abdomen is mildly distended. Look for mediastinal shift manifested as tracheal deviation and/or jugular distension. Grader will state casualty does not have tracheal deviation, but has mild jugular distension. Look at and feel the patient's chest for signs of air in the chest wall, subcutaneous emphysema. Grader will state you feel a crackling sensation on the casualty's chest. Check for unilateral distension and chest expansion, excursion. Place one hand on the affected side. Place the other hand on the unaffected side. Observe the height of each hand as the chest rises and falls. Determine if the height of the hand on the affected side is greater during expiration than the hand on the unaffected side. Grader will state the hand on the unaffected side is higher than the other. Look for bluish skin. Grader will state you observe mild cyanosis. Look for signs and symptoms of shock. Grader will state you observe 2 signs of shock, Grader's choice. Performance measure 3. Locate the insertion site. Locate the second intercostal space between the second and third ribs. At the midclavicular line, approximately in line with the nipple on the affected side of the patient's chest. Performance measure 4. Thoroughly cleanse a 3 to 4 inch area around the insertion site and begin in the center. Work outward using a circular motion. Performance measure 5. Apply a commercial needle decompression kit according to manufacturer's instructions, or improvise by inserting a large bore 10 to 14 gauge needle with attached catheter. Steps below. Place the needle tip bevel up on the insertion site, second intercostal space, midclavicular line. Lower the proximal end of the needle to permit the tip to enter the skin just above the third rib margin. Firmly insert the needle into the skin over the third rib until the pleura has been penetrated, as evidenced by feeling a pop as the needle enters the pleural space. Remove the needle and discard per unit SOP. Performance measure 6. Decompress the affected side by aspirating as much air as necessary to relieve the patient's acute symptoms. Performance measure 7. Apply a commercial one-way flutter valve according to instructions, or improvise one method below. Cut a finger casing from a sterile glove. Cut off the fingertip. Tie or tape the finger casing to the needle hub. Check the operation of the improvised flutter valve. Ensure that air passes through the needle valve assembly and improvised flutter valve on expiration. Ensure that the flutter valve collapses against itself on inspiration. Secure the catheter to the chest. Performance measure 8. Measure pulse and O2 sat. Candidate can perform this step on themselves or another soldier since the casualty must be a mannequin, or grader can prep the device screen with degraded vitals. Wipe the index, middle, or ring fingertip with alcohol to ensure it is clean and dry. Apply the sensor. Document the readings on the TC3 card. Performance measure 9. Record all treatments on the TC3 card. Front of card. Evacuation evac. Mark X on the casualty's evacuation priority, precedence. Urgent, priority, or routine. Date. Write the date of the injury in day, day, month, 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 year, year format. For example, 29 JUN 13. Time. Write 24-hour time of injury, indicating whether local L or Zulu Z times such as 1300 Zulu. Mechanism of injury. Mark an X on the mechanism of injury or cause of injury. Artillery, blunt, burn, fall, grenade, gunshot wound, GSW, improvised explosive device, IED, landmine, motor vehicle crash collision, MVC, rocket-propelled grenade, RPG, or other. Specify. Mark all that apply. Injury. Mark an X at the site of injury or injuries on the body picture. For burn injuries, circle the burn percentages on the figure. If multiple mechanisms of injury and multiple injuries, draw a line between the mechanism of injury and the anatomical site of the injury. Time. Write what time of vital signs were taken. Pulse, rate and location. Write casualties' pulse rate. O2 sat. Write casualties' O2 sat. AVPU. Write casualties' level of conscious. AVPU. Alert, response to verbal stimulus, response to pain stimulus, or unresponsive. Back of card. Evacuation, evac. Mark an X on the casualty's evacuation priority, precedence. Urgent, priority, or routine. C. Mark an X for all circulation hemorrhage control interventions. For tourniquets, TQ. Mark category, extremity, junctional, or truncal. And write name of TQs used. For dressings, mark category hemostatic, pressure, and/or other, and write what type of dressings used. B. Mark an X for all breathing interventions. Oxygen, O2, needle decompression, needle D, chest tube, chest seal, and write the type of devices used. First responder's name. Print the first responder's name. Last name, first name. first responder last four. Write the last four numbers of the first responder's social security number. This completes the task M7. Apply an occlusive dressing and perform a needle chest decompression. Check on learning. Question 1. What is bluish skin called? Question 2. What is the first step of applying an occlusive dressing? Question 3. Which way does the bevel face when inserting the catheter? Question 4. How many fingers can you use for the pulse oximetry device? Question 5. What are you observing when you place both hands on the chest?